We all begin life's journey the same way. We're little, we're vulnerable, and there's not much we can do for ourselves. If we're fortunate, we soon discover that there's a somebody right beside us to help and start us on the right path for life. Our mother may very well be the most influential person we may ever know. Sadly, life's journey doesn't always begin in this ideal way for the littlest among us. Babies can be born prematurely or born with developmental disabilities. Some die at birth. A mom can find her own health in risk during pregnancy. In 1986, the nation began to notice an alarming rise in the number of deaths to newborns and their mothers. And so a movement began. In New York State, perinatal networks were formed to attack the root causes of these statistics. We were one, Mothers and Babies Perinatal Network of South Central New York.
Our region is large. In fact, when we look at ourselves in context to the perinatal networks in New York State, we are the largest geographically. We started out covering 6 counties: Broome, Shenango, Cortland, Delaware, Tioga, and Tompkins. And then in very few short years, 2000, we were asked to include Otsego County, and by 2004, we were asked to include Chemung County. So we currently have a footprint in 8 counties throughout our region, and it's pretty amazing to work with all the different providers throughout the region.
It's a very personal decision for me to donate my time and be a board member. I'm very proud to be affiliated with Mothers and Babies. And one of the reasons is because I was a teenage mom, and Mothers and Babies didn't exist when I had a young baby and really knew nothing about how to take care of it. It was just luck that she survived, that I didn't do anything wrong. And for example, we all know now, or hopefully everyone knows now, that the only safe way to put your baby to sleep is on its back, and in a crib or bassinet that is completely flat, and there can be no blankets, no toys, no pillows, because all of those things add to the risks of your baby dying from sudden infant death syndrome.
Today, Mothers and Babies serves an 8-county area with a mission to improve pregnancy and birth outcomes and to promote the health and well-being of all individuals and families. That's no easy task, but through intensive collaboration with nonprofits, government, healthcare providers, and communities themselves, we are helping to change the way everyone thinks about families, sex, and health. 4 key areas make up our primary program offerings, and within each, we provide resources designed to support pregnancy prevention, healthy births, healthy families, and healthcare problem solving. Our PAL centers recognize the critical and challenging role parents play in child development. They remain part of one of our most successful programs. PAL stands for Parents as Leaders, and within our PAL Family Centers, we provide families with resources, support services, and often a time and place to enjoy one another as a family. PAL centers have made a real difference.
Supervised visits when a child has been removed from the home and they're placed in foster care. And the parents come to the PAL Center to visit with their child during the supervised visit. So they can come, it's pretty much set up for the family according to their circumstances and how many times they can visit a week.
I felt like when I got to kindergarten there were so many opportunities that I had already seen at the PAL Center that I was already kind of at a level where I was reading books before I even got to kindergarten, so I feel like it really gave me the upper hand when it came to school and making friends once I got into kindergarten.
Angelica was an only child, and she didn't get a lot of socialization, so it was for her to learn to get along with others before she started school.
Our Teen Pregnancy Prevention Program is another one of our core programs. Its mission is to help teens envision a positive future. So we take our message inside area classrooms where our educators explain how risk-taking behaviors can lead to unwanted pregnancy. We incorporate life skills education and teach the benefits of healthy relationships and good decision-making. Even the kids are surprised at what they learn. Starting a family as a young parent means you must make important decisions immediately about health care for you and your children. Mothers and Babies offers free health insurance enrollment and problem-solving support that's ideal for a new family. Our navigators help families steer a course through the process required for qualification. Since the program began, we've helped thousands of young families decide on insurance plans and costs, find a doctor, and even find transportation to make a medical appointment. Our Perinatal Services program was our very first core program. Today it works to reduce the number of babies born too soon or too small and/or who die before the first birthday. Educating pregnant women and their families is critical. But after a baby is born, we can provide support services including mentoring and home visits. Our community health workers work with local jails and drug treatment programs to assist pregnant women and new mothers striving for recovery.
A lot of what is happening is the drug problems in our area. And we have someone that helps them with that, get connected with where they need to go, or if they're already in services, getting out, what do they do once they get out of the services?
From helping to prevent unwanted pregnancy to learning the best ways to start your lives as a new family, we're proud to have been on the forefront of effective strategies that have helped change lives. From quitting smoking to safe sleep for babies to awareness about the dangers of shaken baby syndrome, we never stop. Our mission is to make sure that all babies are born healthy and stay healthy for life. And so, we rely upon a host of local, regional, and national partners to help and guide us. Inside our walls, guidance comes from a board of directors that represents a cross-section of our community. Business and community leaders, health professionals, parents, and those who just want to help us make a difference are all a vital part of our team. So too are the over 50 passionate and skilled individuals who work here. They remain on the front line to help us provide counsel, outreach, and education.
The staff here are incredible. Everyone is extraordinarily passionate about the work that they do. We know and see the needs in the community and the gratitude that we get from people that we're serving. And then the other opportunity I've had is to be involved at the national and the state level and learning about sort of emerging issues internationally and nationally, and then being able to bring that back here and really taking that and implementing it in these communities is just so exciting that it puts us on the forefront a lot of times.
You know, people come in and they need something, and we find the answer for them. If we can't help them here in the office, we find someone outside of our agency that can help them.
Sadly, our work will never end. Whether we speak about the need for parents to incessantly talk to their teens to keep the lines of communication open, or remind mothers-to-be about the harmful effects smoking, drugs, and alcohol might have on their unborn child, we're trying to provide ideas, incentives, and information about what it takes to live healthy. We're trying to stay one step ahead of the dangers we've witnessed in the past. Life's journey needs some help at times to keep it moving safely forward, and that's what we do. For every mother, for every baby, for every family, we're here to help. Mothers and Babies, caring since 1989.